today's topic is basically how to ace the TDM exam, okay, with no stress and overwhelming study materials. Very, very important presentation so we can all get through to this. So, I am Dr. Broni and I want to welcome you. The story of many TDM candidates is, Dr. Broni, I'm stressed. How do I study the CTC? And when I talk about the CTC, it is what we call the Compendium of Therapeutic Choices. And I'm going to show you that book. I brought mine. This is the old edition. This is the 7th edition, okay? And the 7th edition itself is 1,748 pages. And this is one of the recommended books for the TDM exam. So I'm not surprised that, a lot of people say, hey, Dr. Broni, I am stressed, I am overwhelmed, I don't know how to, study very well this CTC. Very big book, but a very, very good book. Okay, as I said, this is an older edition. There are newer editions which have come into the system. And this is what you need to review for this very important exam. Okay, however, because of the way things are done, I'm just sharing some of the good news we've had from some of our candidates. So this is someone who sent me an email, and that is my name. It says, hi, sure I will. If not for your TDM course, I wouldn't have passed. Thank you again. So this is a doctor who is currently in the practice ready assessment program. And look, as I mentioned these things, if you want to ask about Dr. Broni, what did you mean by practice ready assessment and all that, just drop it in the comment section. But at this time, I just want you to share it with your friends, okay? Share with your friends so that we can get things going. Another one says, I've passed the TDM. Thanks for your support, and I'm ever grateful to you. Awesome. Awesome testimonies from doctors from all over the world. Another one said this message that Dr. Nana, that's another name, that's another part of my name. Thanks for all the input and the help. I passed the TDM. Next, wish me luck with the rest of the process. I hope you can guide me through. And this doctor is also in the practice ready assessment in BC right now. And I said, big congratulations. You have made my evening. You do great. And then I have another doctor. Look, this is even awesome. This doctor was pregnant at the time, she was preparing for the TDM. He says, I gave birth to my son on the 29th of April, studied for 3 to 4 weeks, and attempted the exam on June 7th. I was mentally prepared for a less favorable outcome. But guess what? She passed as well. So what I'm trying to say is that it's great. Now I have Dr. Neslejan. Dr. Neslejan, she's from the Netherlands. She joined us all the way from the Netherlands to take the TDM exam. And now she's practicing in Alberta. So she came in through the practice ready assessment route, and now she's practicing in Alberta. So as I said, if you have any question about this particular exam or any other exam, just drop the questions in the comment section and I'll deal with it. So what is the TDM all about? And what areas should candidates focus on? At the bottom of the screen is scrolling all the upcoming exams. And many people are not very familiar with the TDM exam. TDM basically stands for Therapeutic Decision Making. Okay? Therapeutic Decision Making. So this exam basically focuses on therapeutics. And when I say therapeutics, what I mean is, it's talking about pharmacologic, non-pharmacologic stuff. How do you manage patients? And that is all that this exam is about. So if you've passed your QE1, if you pass your NACOSCI, and in some provinces in Canada, you don't need NACOSCI to get into the practice ready assessment for family medicine. So if you've passed the QE1 and say you are in Alberta, you need to start preparing for this particular exam, okay? So it is the therapeutic decision making exam. Now, someone may ask, Dr. Broni, as you do all the time, what is the distribution of questions? The distribution of questions is that this is a particular exam that the total number of questions you'll be solving will only be 40 questions. Okay, 40 questions. Now, what is the percentage of the distribution for the various parts of this exam? So you realize that I told you that this exam is only about management. So you will see that when it comes to medication and pharmacologic interventions, that will cover 70% of the questions. And I'll go on to explain what each of these points mean. And then when it comes to the non-pharmacologic aspects of this exam, that covers 30%. That covers 30%. So you must learn, drug names, drug classes, drug interactions, prescriptions. That will cover 70% of the questions. And then the non-drug interactions like, massage, chiropractor referral, physiotherapy referral, those kinds of things will cover only 30%. Now, what about the various dimensions of care? So like the QE1, this exam also has its dimensions of care. And the percentages are this. So you will see that 30% of the cases will cover chronic conditions, okay? Chronic conditions, 30%. And then 30% of the cases will also talk about medication safety and adverse effects. So that's a 60%. So if you're able to cover chronic conditions and medication safety and adverse effects, you've covered 60% of the cases. Then 25% of the cases will cover acute issues. So the acute issues, when I talk about acute, what I mean is more of emergency medicine stuff, right? And then 15% of the cases will cover more of health promotion, and illness prevention. So what do you do? Immunizations and all those things that will fall under health promotion and illness prevention. So when you are studying, you've got to expect questions from all these areas, but you must also know where to place more emphasis, right? More emphasis, because if you know how the questions will be distributed according to the medical council, then that will help you to know where to place emphasis so far as this is concerned. Now, so when it gets to health promotion and illness prevention, what is it all about? That part is the process of enabling people to increase control over their health and its determinants, and thereby improving their health. Okay, so illness prevention covers measures not only to prevent the occurrence of illness, such as risk factor reduction, but also to arrest its progress and reduce its consequence. So, in other words, part of the exam is going to look at, periodic health exam, population health issues, patient education, advocacy, right? Those are the things that part of the exam will focus on.